welcome to another episode of the KDHE Dispatch. I'm Miranda Steele with the KDHE Communications Office, and today we're going to talk about quality improvement, or QI as it's called, and how our QI tools are helping the Kansas Department of Health and Environment improve the health of Kansans through the processes that take place inside the state agency. So we're just going to let you in on some inside activity about how we're going to improve quality of our services through these QI tools. So with me today I have Kate Watson. She is the director for our Center for Performance Management. Then we have Roger Zornes. He is a research analyst in our Bureau of Epidemiology and Public Health Informatics. And then Jessica Willard. He's an environmental scientist with our Bureau of Waste Management. Welcome everybody. So let's start with you, Kate. So how can QI improve the health of our population?
Well, the public depends on our agency to provide services in the most efficient and effective way possible. So by infusing QI in our daily work, it puts us in a better position to serve and protect the health of our communities. You are getting ready to mention that we're going to be hearing from epidemiology and waste management in a few minutes, but if we think about infusing quality improvement in some of our processes, for example, looking at improving our ability to better detect disease outbreaks and implementing programs to reduce obesity, that definitely has a positive impact on our population health.
So we're helping the internal processes, ultimately providing better services to our external audience, which is all Kansans.
Yeah, exactly.
Okay, so how is KDHE doing so far when we talk about building this culture of QI, implementing the quality improvement tools?
Mm-hmm. Yeah, I think we're doing really well. Of course, it started out a little bit slow as this kind of a monumental program usually does, but we have really made a lot of progress just in the past 6 months. I hear on almost a weekly, daily basis about from KDHE staff that are implementing QI projects with some great success. One of the most common QI projects that I hear about are folks identifying their work processes step by step, so they can identify where they're bogging down in the work or where they're bottlenecking, and then they apply a really basic QI tool to either reduce or totally eliminate the bottleneck, and that really saves them a lot of time, so then they can take the time saved and apply that to projects that have been taking the back burner.
Okay.
Other ways that we're progressing with QI is that we have just this last week, we have finished the development of a QI Council charter. Our council is going to have representatives across all 3 divisions of KDHE, as well as all levels and positions of KDHE staff. The council will be responsible primarily in the beginning for developing a KDHE QI plan, and that plan is really going to be our roadmap for implementing QI across our agency in a standardized way. And with all this QI work, this is really going to put us in an excellent position for becoming an accredited health department. So our plans are to apply for accreditation this spring, and hopefully by this time next year we'll be a fully accredited health department.
Great, but it won't stop there. We'll continue
No.
quality improvement and continue the great work to remain accredited, and great work on your part.
Thank you.
In bringing about additional team members to help guide that process, and all of the work that you're doing behind the scenes.
Well, thank you, Miranda.
And now we turn to Roger Zornes with our Bureau of Epidemiology and Public Health Informatics. Roger recently presented on his quality improvement project, and as a QI coach, he's here today to tell you how that's been going. Roger?
Well, it's been going pretty good, Miranda. We've got into what we call our evaluation process. We're looking at all of our processes for producing an end product out of our section. As a QI coach, I was looking into what could we do as a QI project in our section, but it seemed like everything I looked at, I couldn't really find a good starting point. So we decided to step back and try to figure out our baseline. So we started looking at all the processes we go through on our standard outputs that comes out of our section every year, be it daily, weekly, monthly, annually, and such. So we're trying to incorporate a evaluation process, and that evaluation process allows us to document all the different processes we're doing, and then once we document those processes, we come back and look at the different activities within that process, and we're doing some flow charting based on those activities, like more of a step-by-step of how we get to the end. And with doing that, we have found some issues within one or two of our processes that we'll be able to come back and address later as a actual QI project. So our accomplishments with this is we've documented all our processes. We're doing some step-by-step to try to find our issues. We've got cross-training going on with all the team members. Now everybody's becoming aware of what everybody else does in the section and how it happens.
So it's an added benefit is the cross-training, like you were saying.
Yes, it is a very added benefit. It's just kind of one of those little extras that happen along. And then we have ownership in this. Everybody gets involved. Everybody has a say. Everybody has a vote. And when it's all said and done, everybody has ownership in all these processes we've put together and documented.
Okay.
Also, we are letting our data and processes guide us to our projects by documenting these and flow charting them out. Because it's too many times you can shoot from the hip thinking you know what the problem is, but then when you spent some time and money on it, you come back and, oh, we didn't fix the problem.
Nothing's really fixed yet, yeah.
So you got to let your data and your processes guide you to where you really need to look at. Do your quality
Great
improvement.
reminder for everyone working on
Yes.
quality improvement projects, and that includes everyone at KDHE. So
Yes.
thanks for that update. All right, so now we go to Jessica Willard with our Bureau of Waste Management. Jessica, you're also a quality improvement coach, and so can you describe to us some of the challenges and just your experience overall with quality improvement within your bureau and working within the Division of Environment?
Well, as you can probably imagine, the Division of Environment, at least the people that I have spoke with and worked with within our bureau and outside of it, it has been a little bit challenging to understand exactly how quality improvement from the public health side relates to the environment side. So on the environment side, we are mostly familiar with quality improvement. Many people that have worked here for a number of years have been through several different quality improvement processes. And so one of the challenges has been relating quality improvement as we know it right now and as we're rolling it out as a standard or as a system of standardization and continuity of quality, which is really where we're going with this, how that relates to public health and accreditation, and what it means for us in the environment side of things to roll it out and implement it in a way that positively affects public health and also serves to protect the environment. And so what's been interesting in this whole journey is educating and help everyone to understand how greatly beneficial quality improvement is in our own individual work practices and how they relate to our external and internal partners. We work with a number of entities, whether that's the regulated community, individuals out there who need help or assistance in one way or another with the issues that they have impacting them in their personal lives as it relates to how they interact with the environment. So the greatest opportunity that I've had as a quality improvement coach has really been to relate the topics of quality improvement, the tools, the methods, the approach, and allow that to seamlessly integrate into the work we do on the environment side. And it's not such a stretch after all. As content experts, we bring a lot of knowledge to the agency, to our work, and that's what we seek to provide to our external customers and internal customers as well. And quality improvement helps us to formulate the ideas and put together the processes that we can then document, standardize, and help that to remain consistent day after day, month after month, year after year, in a seamless manner that helps bring us whole agency together as a consolidated unit to better provide for protect our environment and provide for public health.
Well said. So what's an example of a quality improvement project in your bureau or the Division of Environment that's going on right now?
Every single project is evaluating how we are interacting with our external partners, how we're gathering data, how we're reporting and collecting to make sure that we don't leave anything untracked. We're documenting the processes that interact with the public. that interact with our external partners so that we can evaluate how effective and efficient they are and make sure that we're making the entire process work smoothly for them, that they have a better overall experience, that their needs are met in a timely manner, and that we're serving the external partners and public as effectively and as quickly as we can.
That's great example to share with everyone. I know your external stakeholders might be a little bit different from Roger's external stakeholders for people requesting vital statistics data or any other public health informatics product. So again, thank you all for being here today. It's clear that there's a lot of great work going on with quality improvement at KDHE. And just with the Bureau of Waste Management and Public Health Informatics, I mean, those external audiences vary a little bit. And when you talk about the services that you're providing to Kansans, and so it just demonstrates that it is all connected, and the quality improvement tools that we're using here across the agency are benefiting us not only internally but externally to help improve the services we're providing to Kansans. So thank you all for being here today, and we'll see you on another episode of The Dispatch.